Back with you on the Newsfeed PM. Thanks for staying on. Transforming the country's health landscape, something important to Ambrose Lekalakala as the Secretary General of the South African Medical Student Union at the University of Limpopo. In the rapidly changing landscape of public health care and challenges faced by some South Africans in accessing quality health care, safeguarding the future of the medical profession and confronting its challenges has become an urgent need. For more on this, we're now joined by Ambrose himself, who is with me in the studio. Ambrose, good to have you, and thank you very much for your time.
No, thank you very much, and greetings to you and all to your listeners.
Tagged with that kind of responsibility, some 10 medical schools across the country, you're galvanizing students there, pushing for the systemic improvement of the medical education, student welfare, as well as healthcare access. Talk to me about when you came into the system. Did you have that in mind? Is that why you came into this field?
No, I don't think I came to the field because my intentions was to transform the medical training in South Africa. The reason I came into medical education was because of where I come from. I come from a rural area in Limpopo where I got to see how the challenges are there in terms of the inequalities within the healthcare system. I'll give you an example. I had a brother who suffered from epilepsy. So when I was born, my brother was sick from since then up until I got into medical school. So the reason why I chose to study medicine was because I wanted to become a doctor that could assist him or even to afford to pay for his healthcare service.
Yeah. So what exposes you to activism?
What got to expose me to activism is that when I got to medical school, I had that intentions to say I'm going to study so that I graduate and look after my brother. But then something happened. God decided to take my brother. After taking my brother, that became a turn of events in my life. Then I realized that much as I got to medicine because I wanted to look after my brother was just a drop in a bigger ocean. That means there's just a lot of people who are experiencing the same thing that he got to experience. That in itself is what made me to realize that there's indeed a need to transform the healthcare system, and hence why I got to be part of all the activism to try to change the healthcare landscape.
Yeah. So talk to us then about the hurdles, just to getting into health education.
Look, the healthcare system or the healthcare training in South Africa, in terms of how it is, we have to appreciate that we are doing very well in terms of how we are training as a country, how we are training the healthcare professional. But we should as well acknowledge and appreciate that there is some sort of gaps here and there that we need to fix. For an example, I can give you that, you see, if you live here, I was in KwaZulu-Natal, the University of KwaZulu-Natal. Yesterday, we were having election of our South African Medical Students Union branch there. What I got to realize is that majority of those medical students who are there have got problems, because now is the issue of they have financial issues, they have got this and that. I'll give you one typical example. There is National NSFAS that is funding majority of our students. NSFAS funds students with the same amount, irrespective of what student is studying. So if you are studying a degree that has a lot of fees or less fees and all of that, they find you the same amount. What happens is that with medicine, you are there for long time. One. Number two, you see, in terms of residence fees, what happens is that when you come in January, you are owing. NSFAS did not pay all the amount that was charged because you were there, but NSFAS has got a cutoff, which in most instances, the residences are higher than the cutoff of NSFAS. So I think that is part of the things that has to be corrected.
Yeah. So there's no differentiation in terms of how you fund medical students as compared to how you'd fund other students, right?
Currently, there is no differentiation. You see, In the past, there used to be provincial health bursaries, whereby there were bursaries for medical students, but these have since been discontinued. And as a result, they just moved medical students, like every other students, to say you will all be funded by NSFAS. But they did not consider the fact that there are disparities, because I can tell you now, medical students are in university for 12 months, but they are only funded for 10 months. Why? Because all other students are there for 10 months. So there's just that assumption to say everyone is there for 10 months.
So what happens with the other 2 months?
Well, in the other 2 months, we find students to be frustrated. Students do not know how to survive. They've got to make extreme measures. And we've raised this before. I'll just give you one example. If you look at the 2025 NSFAS finding guideline, you will realize that it is clearly stated there that in the year 2025, healthcare students and medical students will be funded for accommodation from January to December. But it is not indicated that they are going to be funded for living allowances, because there is living allowance, there is also accommodation allowance. They only indicated accommodation allowance. That tells you that they understand that the students are there for 12 months in terms of accommodation, but they don't understand in terms of, living allowances. But also, I'm telling you now, the students did not get the money for this year, January.
Wow.
And we're thinking that they're not even going to get in December. We've tried to raise this with NSFAS, including with the previous minister. We're continuing to engage even with the new minister, Butimana Mel. We hope we're going to find solutions.
Now, Ambrose, what has made you a champion here? I mean, to the point where even Mail and Guardian has picked you as one of the top 200 most influential South African young people.
Yeah, you see, one thing I will tell you is that when you become a leader of a movement, most of the time, when the organization does well, people are going to say, this organization is doing well. But when the organization does not do well, they are going to single you out and say, this leader is doing terrible things. But when I got this award, personally, I must be honest, I was humbled. Equally, I was emotional. But at the same time, it made me realize that there is recognition, and that it means there's a hope that all people, irrespective of whoever they are and wherever they are, little impact that they are making, it's recognized. Because much as I was the one who got to be, awarded, but the work that got to be done is the work that was done by the collective.
What happens to you, I mean, in the system, for example, when you are seeing contestation now for healthcare access between locals and foreign nationals?
Yeah, you see, that is a complex topic that I think has to be debated at a level of officials in terms of what must happen, in terms of controlling, who comes in, how do they come in, who pays what, how do they pay, and all of that. That is a policy question that I think we have to allow those that are responsible to get to deal with it. Because my only comment to that will be that in terms of access to health care, that is a universal health right. The universally acceptable principle is that access to health care, it's a right given to everyone, irrespective of their status, what documentation, and all of that. But at the same time, there's also the issue of who comes in, how did they come in, and all of that. Hence, I'm saying that I think must be a debate we should leave for the officials that are responsible. But at the same time, everyone who needs health care must be given health care.
Talk to me about that. I mean, you're from Limpopo. You're saying now you were conducting some elections in KwaZulu-Natal. When you look at the question of access, how can that be improved?
Look, to improve access to health care, in my own personal view, it's very simple. What do? You make sure that you hire enough healthcare workforce, because as things stand, the healthcare workforce, it's simply inadequate. It does not meet the demand, because in terms of the WHO recommendation of 1:1,000, the doctor to patient ratio, we are nowhere close to that, because as things stand, South Africa stands at 1:1 and upward of 3,000, meaning for every one doctor, there is more than 3,000 patients. So there is no possible reality where we are going to be able to provide the best of healthcare system. So the only thing that needs to happen is that all unemployed doctors must be employed, and where in the public health system. Why? So that these people can go in the far-flung areas to look after our communities. And I'm saying this because an upward of 85% depend on the public healthcare system. So the only way to solve this problem, you just employ healthcare workforce, and you know they are going to be able to meet the demand. The other question of who must come in terms of patient, that will leave to policymakers.
Yeah. Brought you in because we believe your story should be an inspiration to many young people who are looking at you and the journey that you have traveled. How would you, what must I say, package your life, right? Sum it up and say to a young person who's watching us today, say, if you look at my journey and where I've come from and where I am today, it is possible for you to.
Yeah, so my advice is very simple. You must start where you are with whatever you have. You must never allow your circumstance to limit you. You must always start where you are with what you have. Recognition will come, but impact will last forever.
Recognition will come, but impact will last forever. Words from Ambrose Lekalakala. Appreciate you, Ambrose, and thank you very much for coming on this afternoon. That is Ambrose Lekalakala. He is the secretary for the South African Medical Student Union, but also he is recognized as one of those influential young people by the Mail and Guardian.